Okay.
Hello, I'm Nazik Hamad. I am the co-chair of the Education and Training Committee for AORTIC. And today I have with me, Miriam.
Hi, everyone. My name is Miriam Mutabi, and I'm a member of the Education and Training Committee and the Vice President East Africa for AORTIC.
And today we will be starting our first video for the faculty development of African oncologist workshop that will take place on November 5th. I will be taking you through the pre-workshop videos and really the why faculty, because faculty is the ultimate resource of all education institutions, according to the Lancet Commission that was published in 2010 on transformative upscale for health professionals for the first century. And faculty are the teachers, they're the stewards of resources, especially in middle income countries. They're the agent of knowledge transmission. And most importantly, faculty are the role models for students. They produce a profession by training the next generation of professionals. So Miriam, I was wondering if you could tell us about what faculty, who is considered faculty in Africa? Yeah. What does that mean?
Thanks, Nazik. And that's a relevant question. I think sometimes when we think of faculty, we automatically associate it with an academic institution. But what we know, especially when practicing in sub-Saharan Africa, is that anyone who's involved with healthcare management is involved with training, teaching, and managing teams. And so, and we all have our own professional and career development goals. So ultimately, these tools will benefit everyone who is in healthcare management and healthcare provision.
And from this came the idea of faculty development for African oncologist projects. This is an AORTIC project. We aim to establish a program. We partnered with the Royal College for Physicians and Surgeons in Canada after obtaining a grant, and with our colleagues at Queen's University. And what we started with is the needs assessment.
And so rather than being prescriptive, we thought it would be interesting to find out what exactly were the needs on the ground. What is it that faculty actually needed? And so we did a preliminary evaluation using a mixed method study, looking at faculty development and really trying to do a deeper dive in what we felt were the barriers, but more importantly, what were the enablers and opportunities that would help to improve faculty development and overall satisfaction. Some of the initial barriers were things that most of you are familiar with, the incredible tension between, academic practice and service delivery, things like, the lack of support in terms of resources for training and really having that faculty development and looking at how could we then help to, as part of this initial step, how would we then go ahead to change the narrative around this?
And so we always ask ourselves, why faculty development? If you want to establish a faculty development program, why do you do that? And the idea is that, faculty now, whether in high income countries or low income countries, they play multiple and very complex roles. And in order for them to do this role, you need a faculty that's professionally fulfilled, it's motivated, it's committed to ongoing intellectual and personal growth, and is fully professionally engaged, enthusiastic, and has positive feeling of aliveness and energy and excitement about work. And that's what we mean by faculty vitality, or having a vital faculty that's able to perform these complex tasks in a world that's increasingly, there's so much service demand, so much research demand, so much teaching demands, and there's a high risk of burnout. And the other concept around faculty development is the faculty competencies. And this is an example from a high income country, from Johns Hopkins University. some of these competencies are so many, including budgeting, financial competencies, communication, conflict management, decision-making, personal flexibility, directing and tracking work, operating skills, or being organizational and politically savvy, planning and problem solving, mentoring, leading, managing diversity, managing vision and purpose, mentoring others, motivating others, negotiating effectively, and having a strategic skills. And I'm sure given the demands on African oncologists, the competencies that they would need is probably a longer list given the demands.
And so following the, Nazik has sort of hinted as to the breadth of competencies required, but then we're trying to sort of narrow down to sort of look at what are the key or what are the core concerns that faculty in the continent would prioritize. And what we've seen resonating through our preliminary research is just the opportunity around personal career development and growth in resource-limited settings. Again, trying to establish good practices in mentoring, both as a mentor and mentee, including the fact that there's so many, for instance, cross-cultural mentoring. You're having very many different dialects, clinicians and workers from different regions. Sometimes distance is a factor where you are mentoring healthcare professionals who are in difficult to reach areas. So how do you then create an effective mentorship program within that sort of context? Again, looking at how do you have a successful interorganizational and perhaps both international and regional collaborations and partnerships that ultimately work towards building the regional improvement in education and research. And then how do you harness all of that collectively, both at a local level, country and regional level, to promote educational scholarship? The other needs that we identified were, again, around the theory and practice of teaching and learning. How do we actually teach? Again, there's one of the key things that many people felt deficient around is just the educational leadership and curriculum development. And again, how to assess our learners. There's been a lot of buzz around telemedicine and telehealth and looking at how do we use those resources or how do we leverage those resources to provide these particular skill sets to our learners. Again, bits around educational administration, selection, admission of learners into oncology training programs. And again, because there's so much heterogeneity that currently exists around training, you have people doing 5-year programs, 3-year programs. The duration is not necessarily the concern. It's what is the quality of training and how do we accredit this training and how do we ensure that, there's equal competencies that irrespective of where you are, the training that you're providing is, the training that you have is making an impact in terms of quality improvement and in providing value-based care to our patients.
And for our faculty development program, we wanted to have the innovative instructional strategy, which is having virtual modules that the African faculty can access anytime and anywhere. And these modules are being currently developed. And the topics are chosen based on the needs assessment that you have provided us with. So these modules are career development and promotion, program evaluation, leadership, mentoring, teaching, and curriculum development. And in the next videos, we will be talking about what these topics entail. And of course, during the workshop, we will be discussing in further details. So thank you very much. And I hope you'll watch our other videos. Thanks.
Stay tuned, everyone. Looking forward to seeing you at the next set of videos.